Hello, my name is Mani Saltarvino, and this is Routine Trauma Knee for my image analysis class. So for trauma and views, it is AP and cross-table lateral. Routine views are an AP, internal oblique, external oblique, and a lateral. A 10 by 12 image receptor is used. Central ray is a ½ inch below the apex of the patella, except for the lateral, which is a ½ inch distal to the medial epicondyle. KVP is 65 to 80. No breathing instructions are used. The internal and external oblique are 45 degrees, and a 5 to 7 degree cephalic angle is used on a lateral knee, which is bent 20 to 30 degrees. And then for patient A, it is a 42-year-old man who has pain, deformity, and little movement in his left knee. Patient B is a 30-year-old man who is an immigrant from South Sudan, and he came to the department due to a construction accident. He has right knee pain. X-rays show abrasions and joint infusion. So case A right here has a cotton wool-like appearance, and as you can see, so Paget disease also has that, and Paget disease is a common bone disease, and this is a disease that makes basically an overproduction of bone in your body, and this causes bone pain, deformities, weaknesses, and all of that the patient A has. And then deformities could also lead to bad joints and mobility, and also lead to osteoarthritis. The cause is unknown. So the bone is clearly misshapen compared to the normal one right here. And it also is slightly bone-legged. The case states that the patient has diffuse bone lesions and a thick bone cortex in the fibula, and uneven densities. The cause is unknown. So for guinea worm, also known as dracunculiasis, is basically a parasite in contaminated waters, mostly in Africa, like South Sudan. And then, as you can see right here, these are dead worms. So basically what happens is the fact that you just drink the contaminated water, the water goes, well, not the water, but the worms go inside your belly, and then the worms mate. The females, the larvae comes out, the females go right down, and they go down to, like, your knees, your legs, goes down right down there. And what happens is the fact that they just like shoot out, basically they shoot out in ulcers and blisters. They come out of your skin at some point. But if they don't come out of your skin and they reach that joint, then basically the female worm will die and release her larva, and then that will cause joint infusion, acute pyrogenic arthritis, and joint pain. And it also looks dead and chainmail appearance and tangled and convoluted, which is exactly what it looks like here. And symptoms are a blister, swelling, vomiting, nausea, diarrhea, ulcers. So the main test for Paget disease is an x-ray just to see if the bones have changed, and a bone scan just to see like how this disease has actually progressed in the patient. So a scintigraphy, also known as a bone scan, basically they inject radioactive substances into your veins just to once again check how the patient has been impacted. And patient A had a technetium 99 conjugated but with methylene bisphosphonate bone scans, and this is what it looks like right here. And for the guinea worm, it is diagnosed just when it visibly comes out of your skin in that ulcer or blister, like just like this. When it visibly, like, you see that little, when you see the blister and you see something poking out, that's the diagnosis right there. But x-rays are also ways it could be diagnosed. But again, the only reason why an x-ray was even diagnosed in the first place was just because if that patient has pain and they think like, oh, they injured themselves, and they take the x-ray and then they find the worms, that is another way that it could also be diagnosed. Just like our patient B, he had a construction site accident and he got x-rays done because of that, and then they found dead worms instead of alive ones. But yeah, that is just the reason. The main diagnosis is, of course, like the worm coming out of the ulcer, but different ways of diagnosis could also be x-ray. Treatments for Paget disease include medication that can be taken orally or injected, occupational therapy, eating well, exercise, and surgeries that could replace joints and align the bones. Prognosis is tumors, fractures, deformities. Our patient has had no surgeries, but they did have zeledronate, which they had 5 milligrams per year. This was injected into their vein. This case was followed for 5 years, and the pain is said to be relieved. So there's no vaccine for the worm. Actually, yeah, no vaccine. And as soon as they see that blister or their ulcer and they see that little worm peeking through, they just wrap that worm around a stick or a piece of gauze and they just slowly just pull it out. The patient is on medication, but it still very much hurts. And they just slowly pull it out. And then as soon as that worm tugs back, they stop. And they just repeat the process. Just once again, keep pulling it out. And that worm could be around like a meter long. And yeah, so right here is where the worm is. These are dead worms to patient B. This is also a worm, and these images right here are the worms, well, the worm of the next patient. This patient is an 8-year-old girl who had complaints of about pain in her left leg. She also had an ulcer, and she also lived in South Sudan. And yeah, they had that worm surgery, taking it out. And for 3 years, this case was followed, and no complaints of pain has been said since, which is great. And so for our prognosis, if left untreated, it could lead to disability because, of course, bacterial infection, and this could be permanent. So additive and subtractive none are needed for the guinea worm because it is a foreign body. For hepatic disease, because the certain densities of the bone in separate areas could be more than others, the exposure factor adjustment should be increased. Equipment cost is $90 to $190K. Sponges around $100, depending on size. Eye holder is from $200 to $300. And that is the end of my slideshow. Thank you so much for listening, and I hope you learned a lot. Thank you. Bye bye.